Thanks, Haley. In this week's Health Headlines, we're talking to New Hampshire State Epidemiologist Dr. Ben Chan about the first ever National Environmental Public Health Tracking Program Week. Dr. Chan, thanks for joining us. Bit of a mouthful there. Tell us what all of that tracking is about in this program.
Yes, it is a bit of a mouthful, and sometimes we have a program called the Environmental Public Health Tracking Program. We sometimes abbreviate that EPHT. But it shouldn't come as any surprise to people that the environment plays a critical role in people's health. There are known environmental exposures or contaminants that contribute to health or disease. As an example, lead is known to contribute to child development, cognitive and mental development. Air pollution contributes to asthma. Radon levels in homes is known as a known cause for lung cancer. Arsenic in well water causes bladder cancer. So there's a whole host of environmental exposures that are known to cause problems with people's health. EPHT, the Environmental Public Health Tracking Program, is a surveillance program that looks to combine data on environmental exposures with human health to try and better understand the impact that the environment has on people's health. So there's three general types of data that we collect. One is data on the environmental hazard itself. So this can be, monitoring contaminants in well water. We're looking at radon levels in homes as an example. We can also look at levels of exposure in people. So some of these chemicals or toxins can be tested for in people's blood. Blood lead levels, which most parents are familiar with because their children may get tested, is an example of that. Then obviously we collect data on human health outcomes, rates of hospitalization, rates of disease, cancer incidence. We've had our program in New Hampshire since about 2002 when the CDC, the Centers for Disease Control and Prevention, started their national program for environmental public health tracking with the goal of learning more about the environment and human health.
What are some of the most pressing issues that we see in the United States, but more specifically here in New Hampshire?
Yeah, so there's a awareness week next week where the CDC and public health partners are promoting or messaging about certain environmental health issues. Obviously, air quality is a big topic. Water quality, especially here in New Hampshire, has gotten a lot of attention. There's a lot of focus on children's specific environmental health issues like asthma and lead exposure, climate health, and then also the community design, which we don't oftentimes think of as an environmental issue, but what we call the built environment. Those are how we design the community around us can impact health. So are there sidewalks? Are there parks to play in? Are there bike lanes which promote activity? These are all issues that are going to be discussed more.
All right. Always lots to think about. Dr. Benjamin Chan, thanks for your time.
Thank you.